Hello, everyone. I am Dr. Kemi Alli. I'm the CEO at Henry J. Austin Health Center here in Trenton, New Jersey, and I am excitedly welcoming our First Lady, Tammy Murphy, this morning to talk about maternal and child health and wellness in our state and the Nurture NJ initiative and the impact it has on our communities. I am so excited to be talking with you this morning. So again, welcome. Thank you for joining us and chatting with me this morning.
Of course, it is always fabulous to be not only in Trenton, but at the Henry J. Austin Center here. I feel like this is my second home in Trenton, but it's always a privilege to be here. I love seeing all the families coming and going, and just the history of this center, the name, Dr. Henry J. Austin himself, unable to practice medicine in his hometown and moved to Trenton specifically so he could practice medicine. Roll the tape forward 50 years. Here we are talking about how the Henry J. Austin will be at the epicenter of helping us to correct the infant and maternal health landscape, particularly as it regards with regards to inequities. I just couldn't think of a more special place to be, and I thank you so much for having me here today.
Thank you, thank you. So I have witnessed firsthand just the amazing commitment and dedication you have had in this space of maternal and child health and well-being, and importantly, the resources that have been put towards this work. It is tremendous. It is commendable. And so on that note, could you please share with us sort of what's your vision and goals for maternal and child health in our state?
Well, thank you. I mean, I guess to frame this a little bit, the United States is 56th in the world for maternal mortalities. And unfortunately, when my husband came into office, New Jersey was 47th out of 50th for maternal mortality rates.
Wow.
So my goal is to make New Jersey the safest and most equitable state in the United States of America to deliver and raise a baby. But I would tell you, this is a group endeavor. We have partners such as yourselves, thankfully, who are on the ground doing the hard work on a day-to-day basis and helping us to actually implement the more than 80 recommendations in our strategic plan that we unveiled in 21.
Wow.
I'm glad to report that because of the hard work of you and our thousands of other stakeholders on the ground, that we actually now are seeing a turn of the tide. New Jersey has just been ranked as 29th in the country, which is fantastic when you start at 47th, but it's not fantastic considering there are 50 states in the United States. So we have a long way to go. But I feel like we're on to something, and I think if we keep working together, we will get there.
Yeah, that's amazing. So on that note, how do you see health centers, community health centers like Henry J. Austin, partnering and collaborating with the Nurture New Jersey initiative specifically to improve and further impact the numbers you just mentioned?
So, as I mentioned I talked about the strategic plan. What I did not say is in 2019, we actually created Nurture NJ. And the whole purpose of that is to work together with all of those who are on the ground and to make sure that we're in an equitable place.
Yeah.
The way that Henry J. Austin really plays a premier role is, first and foremost, there is no place like Henry J. Austin in the Trenton community. You are a shining light for Mercer County, and I believe in working together with us and collaborating on all of the recommendations in our strategic plan, that you have actually created a national profile beyond the state capitol. And that's terrific because you do incredible work. You're the ones who are touching the moms and the babies, and we need good partners who are able to work together with us to really make sure that we eliminate the inequities in healthcare and make sure that our moms and babies are in a great place.
Yeah. You mentioned equities, and I heard that word, and that's health equities is a crucial piece. It's been talked across the nation, right, in terms of how do we move the needle in disparities between Black moms and other moms across the country. It's an issue. How do you specifically see the Nurture NJ addressing those disparities in healthcare access and outcomes among the underserved populations in our community?
So, New Jersey, there are 37 deaths for every 100,000 live births. That compares to the rest of the country where there are 20 deaths per 100,000 births. When one drills down and tries to understand why is this happening, the horrible fact emerges that if you are a Black woman in New Jersey, you are nearly 7 times more likely than a white woman to die from maternity-related complications. And if you're a Black baby, you are 3 times more likely than a white baby to die before your first birthday. So from my vantage point, that is racism. It's something that we have got to grapple with. And the only way we can do that is by including our community partners, talking to everyone on the ground and making sure that we are listening and that we are providing the resources and the services that are needed. We have a saying in our office, not about us, without us. And we try and live that every single day. So I would tell you that, when we were coming up with our strategic plan, we looked around the country to take best practices from any other states and try and understand how we can be better. And one of the states that actually was able to reduce maternal mortality rates by 50% over 5 years was California. They did a great job, but they did it at the expense of our mothers and babies of color. So we added, not only do we want to reduce our maternal mortality rate by 50% over 5 years, but we want to ensure there's equitable health care across the spectrum. So, we do this together, and as I said, every single day is steeped in equity and in trying to break down any barriers that exist.
You mentioned a couple of things, and one, sort of the Nurture NJ initiative. It's statewide, and I can imagine there's a lot of collaboration that needs to happen, and you talked about that. How do you see opportunities for organizations like Henry J. Austin, other community health centers, to collaborate with others, other organizations, other governmental agencies in helping to shape and reduce the outcomes that we're seeing today?
So not one single one of us is going to be able to fix this. This really does take a village to turn this around. I remember when we started out, one of the first things we did under the Nurture NJ banner was we created something called Family Festivals. You are very familiar because Henry J. Austin has been part of our Family Festivals. Thank you. But the Family Festivals are a way of bringing together state, county, and local resources in one place for 4 hours in a given day. They take a tremendous amount of work to bring together because we usually have somewhere between 50 to 120 providers. Think of it as a little bit of a job fair and a block party. But I think what I would say to you is I remember the very first one, and I was really worried because I said, this is fantastic while it's on the ground, and we've now helped nearly 7,000 families. So it's fantastic. However, I was concerned, what about the person who didn't hear about it? What about the one who had to work? And I was so relieved to see providers actually saying, hey, what do you do to another provider? And then watched as they shared business cards. And so what we are creating across our state is a safety network, a social fabric where Henry J. Austin can work with the Motor Vehicle Commission or with one of the doula centers, and we're creating this safety net for our moms and babies. So I would say that that's one way, but there's ample ways, and you're in this business every day. You're on the ground, better than I do, probably.
That's right. I want to ask you about, talk about mental health. And so we know across the nation, particularly post-COVID, it is now well understood that mental health is a key component in overall health and well-being. How how do you think about mental health and its impact in the maternal and child health space? And how do you see community health centers playing a role in that?
So, wow, there's a lot to tackle here. First of all, I completely agree with you. Mental health has probably always been a problem, but post-pandemic, it's unavoidable. Everyone understands this now. And to that end, just a couple months ago, my husband and I finished a year-long travel around the United States, working on two initiatives: youth mental health on the one hand and infant and maternal health on the other.
Wow.
We had the opportunity to travel to red states, to blue states, to work with indigenous populations and Native Americans, and just to see firsthand and to hear the lived experiences. And I would just say that the good news is that as a byproduct of that exercise that we did, we have now dropped two different playbooks, one for youth mental health, one for infant and maternal health, that can be used on a national level by anyone. Any state that wants to start tackling some of these scourges can do so.
That's excellent.
Here in New Jersey, again, it goes back to your being on the ground. The fact that you are there day in, day out, you get to know your clients.
Yes.
There's no replacing that.
Right.
We are working, at the end of the day, this comes down to the social determinants of health. It comes down to ACEs. And I'm really so proud of one thing that we are doing in New Jersey. And the pilot, in fact, is happening in Mercer County, and we're having great results from that. And I'm sure you know exactly what I'm going to say, which is universal nurse home visitation.
Yeah.
This is a game changer because it enables these nurses to physically be present in a family's life.
That's right.
And to be able to bring resources to bear that a family might not know about or not know how to access.
Yeah.
And certainly the mental health piece is a part of this.
Right.
And I'm just so excited about it. I really do believe that this will really move the needle in our state, and we are going to have the most robust program in the nation.
That's amazing.
But we couldn't do it without you.
Thank you.
Yeah.
Thank you. You touched upon something, and I'm keenly aware of and very interested in, is ACEs. Could you share a little bit about your thought of ACEs and its relationship to the Nurture NJ program?
Well, I would tell you that what goes around comes around.
Yeah.
And if we can stop a challenge from being cyclical and just create a safe space and create an exit point for that challenge, then we're all going to be better off.
Exactly.
And for Nurture NJ, we talk about transformational change.
Yes.
That's the only way that we are going to see the results that we want to see. And ACEs play a big part in this.
So thank you so much, First Lady Tammy Murphy. First Lady Murphy?
Whatever.
First Lady, thank you so much for joining us today. I really appreciate having you here and speaking with you and really getting your thoughts and opinions on the great work that you are doing, that your administration is doing in terms of really helping to reduce those inequities that we talked about, really helping to reduce the disparities of mothers and their babies in our state. Thank you so much.
And Dr. Ali, I can't thank you enough for your leadership here at the Henry J. Austin Center and for your foresight in seeing where we are going and having that plan and working so terrifically well with us on this endeavor. So we will make New Jersey the safest and most equitable state in the United States to deliver and raise a baby, and I'm counting on the Henry J. Austin Center's collaboration.